low blood flow is the #1 brain imaging predictor of Alzheimer's disease. Anything that decreases blood flow decreases brain function. And so it's why I'm not a fan of caffeine or nicotine or marijuana, because all of them decrease blood flow. If you have hypertension, you got to get it treated because that decreases blood flow. If you're sedentary, that decreases blood flow. If you're overweight, that decreases blood flow. In fact, of these 11 risk factors, if you're overweight, you have 7 of them. And 72% of the population is overweight. And people don't think about that, as your weight goes up, the physical size and function of the brain goes down, which would scare the fat off anyone. R is retirement and aging. The older you get, I'm going to be 69 this year, the more serious you have to be. And I'm a bit anxious about that. I mean, I do the right things, but I've seen thousands of 60, 70, 80-year-old brains, and it's not good news, right? As your skin sort of falls off your face as you age, that same process happens in the brain. I is inflammation. And, the surprising thing about inflammation, and a lot of people are talking about it, but for my patients, it's like if you have gum disease, odds are you have brain disease. If you have gum disease, odds are you have heart disease. If you have gum disease, your gut's probably not healthy. So I became a flossing fool. And I'm at the dentist regularly. I floss every day. I'm serious about the health of my mouth, because if that's not healthy, my brain won't be healthy. And then G is genetics. And I think we don't think about genetics, right? We're like, what's the genetic tests? And they're not awesome. I've been very disappointed that, your genetic test will tell us much. But what I am very clear about is you should know your family risks, like mine's heart disease and obesity. And when you know your risk, you should be on a prevention program every day of your life. So rather than, I have heart disease because it's in my family, it's, I don't have heart disease because it's in my family. Or for people who have alcoholism in their family, they go, I drink too much because my dad and grandfather drank too much. I'm like, well, that's insane. If you know it's a risk factor, you should avoid it like the plague. And so I studied children and grandchildren of alcoholics. My first wife grew up in a very abusive alcoholic home. And so from the time my kids were like 10, I'm like, there are drinking problems in this family. If you don't drink, you won't have a problem. If you drink, you might have a big problem. So it's knowing your risk factor and being on a prevention program every single day of your life. I think that's the most rational thing to do. And then head trauma, which we'll talk about, single most surprising thing I learned from my database. But the T is so interesting. It's toxins. And we live in a toxic society. And you've heard about this dramatic rise in autism. That's not a genetic thing by itself. It's a gene environmental interaction, and I think it's a gene toxin interaction. It's the toxic products we put in our bodies. It's some of the toxic medicines that parents take. It's, we just live in this toxic soup that, whether it's the drugs that have now become innocuous in the public mind. I always say the big innovations for 2023 are marijuana, ketamine, and magic mushrooms. These are the big psychiatric innovations. I'd much rather them be lion's mane, mushrooms, and a healthy diet and exercise and avoiding putting toxic products on your body. So, surprise for me, the app Think Dirty? Mm-mm. It's a great app. And it allows you to scan your personal products
Is it EWG?
Like EWG.
Okay, got it.
And it'll tell you on a scale of 0 to 10 how quickly they're killing you. So, for example, I shaved for Barbasol since I was 14 years old. So, for like 50 years, I shaved with Barbasol. On a scale of 0 to 10, 0 is good, 10 is kill you early, it's a 9. And I'm like, oh no. So now I shave this morning with something called Kiss My Face, which is a 2. And it's actually not more expensive because it lasts forever. But imagine all the toxic products parents are putting on their children's bodies. The dermatologists won. They made us afraid of the sun. And so now we have this epidemic of low vitamin D levels, but we also have this epidemic of kids carrying a toxic load in their body. And if your body's toxic, well, it means your brain is toxic too. And like, I'm a psychiatrist. Why do I care about that? Because I would look at scans and I'm like, ew, that scan looks like he's a drug addict or an alcoholic. But they're not. It's because of the toxins. Mold is another toxin that's common. General anesthesia, that's a surprise. That was a surprise for me. General anesthesia can be toxic to the brain. People have coronary artery bypass surgery, have a higher incidence of dementia. So under toxins, there's a whole list from air pollution and water pollution and pesticides on foods that you just like, oh, what to do.
Well, you know, that for those that are listening, you know, you just put your hands on your face and you're like, oh my gosh, right? And I think a lot of people, when they hear about these things, it's like, oh wow, like where do I, begin? Obviously here at Amen Clinics and you guys working individually with patients, you're helping people put together a personalized plan. But for the folks that are listening, that are out there, when they're listening to these top things that are root cause drivers of brain injury in some form and restriction of blood flow, what have you found to be hierarchical and that would allow people to help understand where to prioritize if they don't immediately have access to like a functional medicine doctor or your clinics? For example, you've shared on my podcast last time, and inside the book, you talk about why you're not a fan of caffeine because of its restriction of blood flow. But you're also a realist, and the recommendation on the caffeine section, which I forgot what day number it is, was like, look, at least try to go for 25% less caffeine or reduce your caffeine intake by 25% less was that day's sort of recommendation. So is somebody how do you balance it out like somebody who's looking at all the different things that they could do in their life? And it's like, okay, should I get started with reducing caffeine or should I start with movement and doing a little bit of strength training and walking every week? How do you approach what gets priority in the context of all the things that we can focus on?
So in the book, there are dozens of tiny habits. What's the smallest thing you can do today that will make the biggest difference? And the mother tiny habit, the most important tiny habit, is when you go through your day, just ask yourself, is this good for my brain or bad for it? And if you can answer that with information and love of yourself, love of your family, love of the reason you're on earth, just start making better decisions. And in the book, I tell about the story about Nancy. So Nancy, who I dearly love, in fact, I think it was this room I first met her. She's 83. She was from Oxford, England. And Crystal, my niece, who used to run this clinic, she said, you have to meet Nancy. She's from Oxford, England. She found your book, Change Your Brain, Change Your Life, in a used bookstore at Oxford University for 50 cents. And she transformed her life. And so here, I met her, and she tells me this story. When I'm 80, I am obese, in chronic pain, depressed, and think my life is over. I find your book. I let it lay around the house for about a year, and then I start reading it. And I was riveted, so that made me happy. And she said, I started writing down all the things to do, and she's like, way too much. So I'm going to do one thing at a time. I started drinking more water. And then she said, it forced me to get off the couch because I had to go pee a lot. She said, but I felt better. And she said, and then I started taking supplements, multiple vitamin, fish oil, vitamin D, because she'd tested her level and it was low. And she said, my mood was better. And then I started walking. And then I started playing ping pong. And then I started dancing. And she said, I'm becoming different. And then I changed my food. And I didn't not eat anything I want. I just ate the good things first, so there was no room for the bad things. So I didn't feel deprived. And then I started learning to play the guitar, and then a language. And I start crying when she's telling me this story because she's the reason why I do what I do. And she said, now getting my family involved, I lost 14 stones. And I'm like, what's a stone? Because I had no idea what a stone was. She lost 70 pounds. And she said, I had no idea that my life could be this good at 83. And for my 83rd birthday, I gave myself a present of coming to the clinic and getting a scan. And if you looked at typical 80 to 90-year-old brains, as we talked about earlier, they suck. They're just not healthy. And hers was stunning. And she cried when she saw that. And it's the big highlight is you're not stuck with the brain you have. You could make it better, and I can prove it. And she cried because she said, I knew last year my brain wouldn't have looked like this. So one thing, and that's why the book is organized the way it is. It's like a 300-word essay. It'll take you 3 minutes to read, and one simple thing to do, because brain and mental health, as Nancy found out, they're daily practices. But you don't have to start everything at once. Just one simple thing at a time. And the mother of all of the simple things, is this good for my brain or bad for it? And that's love. Like when I heard so many people go, I can't have this and I can't have that and I can't. And it's like, you're a baby in brain health if you think that way. That's the wrong way to think about it. When Drew Carey lost a lot of weight, he said eating crappy food isn't a reward. It's a punishment. And I'm like, oh, he's going to stay healthy because he's got the right mindset. As soon as your 4-year-old's in charge of your life, you know, I want what I want when I want it. You're never going to get healthy until you go, okay, so what do you really want? And if I asked you, what do you really want when you see the plate of nachos or ice cream float or whatever? What do you want? I said, I want that. I was like, come on, what do you really want? For me, I want energy, and I want memory, and I want good decision making. I want creativity. I want longevity. And I love my 6 children. I never want to live with them. Love them, never want to live with them, right? When they go, bless them. I mean, yes.
You're talking about when they leave the house.
When I'm 70 or when I'm 80 or when I'm 90, I want to have clarity for the rest of my life. I never want to be a burden. But I think people don't focus on what they really want and how their habits serve them or hurt them. Because like alcohol doesn't serve any of these habits that I want. Energy, memory, longevity, health, independence. It damages it. And yet, I predict, I know I'm like going on a side street.
That's the beauty of podcasts.
That alcohol is going to become like smoking. That, if you look at someone who's smoking, you're like, really? Seriously? It's bad for you, it's bad for me. Alcohol is going to become that. It's not yet, but I think in the next 15 years. And we're up against a big industry, like a $1 trillion industry. But it's starting to change. The American Cancer Society came out against any alcohol.
Yeah,
I mean, like the American Cancer Society. There's a group in Canada that just, I did a post on it and got over 1 million views. They said they need to put cancer warnings on alcohol labels.
When earlier you were chatting, just piggybacking off this alcohol thread, because we talked about it a little bit last time and you shared some of your thoughts that are there. And you already see, a lot of people, even in the health space, becoming more comfortable telling their audience, like, look, I just don't have alcohol. Or I've greatly and significantly reduced my intake to the place where it's like, okay, great. A friend's wedding or a situation or whatever. But it's like, I don't even call myself a social drinker. So a lot more people are speaking out about that. You were chatting earlier, you put kind of alcohol. We briefly chatted about this, but we didn't go too much deep into it. Marijuana, but you've talked about it in a social a lot. And then you've also talked about magic mushrooms, right? Psilocybin inside of there. So I want to talk about those things just because you brought them up right now. So marijuana, for those that are not familiar with your content, is the primary place that your biggest concern is around is, again, going back to this restricting of blood flow to the brain. Is that what you're seeing when you do these scans?
So I published a study on 1,000 marijuana users. Compared to healthy, every area of their brain is lower in blood flow and activity. Every area. And then I did a study. I did the world's largest brain imaging study, 62,454 scans on how the brain ages. And it's fascinating. Little kids have very busy, active brains, sort of stabilizes around 25 to about 60, and then it's a slow march lower. And then we looked at, well, what accelerates aging? And we have this massive database using marijuana, using alcohol, using cigarettes, having diagnoses like depression or ADHD or schizophrenia. Schizophrenia aged the brain the most. But what shocked me is marijuana aged the brain the second most. And I'm like, well, that's not a good thing. And now alcohol's not good and nicotine's not good for the brain. But why would I ever do anything that ages my brain? The second thing, and I'm also a child psychiatrist, and I've known for a long time that marijuana in adolescence is bad for the developing brain. It demotivates kids. If I had a 14-year-old who all of a sudden has ADD, but they didn't have ADD when they were 12, I'm like, you need to pee in the cup. I mean, you needed to do a drug screen. And marijuana was the most common offender. Teenagers who smoke, and my big concern as the perception of the dangerousness of a drug goes down, its use goes up. And now marijuana is everywhere. I mean, you live in LA, I live in Orange County, there are pot dispensaries all over the place. It's good medicine. So teenagers are smoking at rates never seen before. But if you use marijuana as a teenager, you have a 450% increased risk of having a psychotic illness. In your 20s, if you smoke during adolescence, you have a higher incidence of anxiety disorders, depression, and suicide. Well, I'm not okay with this. And what's happening in your brain in your teens and early 20s? You're building the highways. I mean, they're getting myelinated, which means they're getting strengthened. They're going to go faster. And you're throwing poison in there, disrupting that, which may end up being a permanent disruption. So I'm like just not on board with it. And I don't know if you remember during the presidential debates, during the Democratic presidential debates, someone asked then Vice President Biden, should the federal government legalize marijuana? And he's like, I think more research needs to be done. And Cory Booker shamed him. I was so angry. He's like, man, are you high? Like Cory Booker decided the science has been set and Biden was high. No, it's clearly not settled. And my experience and my research says I'd avoid it if I could.
Yeah, there was a great book that I came across a few years ago. The guy's a little controversial, but his name is Alex Berenson, former New York Times journalist who wrote a book, Parents Tell Your Kids the Truth About Weed. And he goes in, and his wife was a expert, I believe she's a psychiatrist as well, and she would be an expert witness for these parents who were saying, like, often a young male who was smoking a lot of marijuana. And people forget that, besides just the general concern, the THC content has exploded.
It's
inside.
like 10 times than when I was a teenager.
10 times more. I've even heard like 20 times more in some instances. And just what that can do to the brain. It's a good book. Again, he's a little controversial of a figure, but I thought he put a great
there's
argument.
a new term that many of your listeners probably haven't heard yet called scromiting. So
I haven't even heard of that.
I adopted my two nieces. So even at home now, I have a 13-year-old and an 18-year-old. And why did I adopt them? Because their parents couldn't stop using drugs. And it was awful for them. I mean, they were just raised in chronic stress. And the older one, and I tell this story in my book, The End of Mental Illness. I dedicate my book, The End of Mental Illness, to these two children. And at 11, Alizé, the older one, named after cognac. So there's some interesting thing about that. Alizé had a damaged brain. It was so clear. Whether it's her mother drank when she was pregnant, I don't know. But we spent a lot of time repairing it. And I'm like, you need to avoid drugs, right? I mean, that's a genetic risk factor. And so I'm always teaching her new words. I'm like, hey, scromiting, look it up. And she goes, it's a combination of screaming and vomiting, which is now common in emergency rooms, right? If you walk in the emergency room and someone is screaming while they're throwing up, scromiting, it's from marijuana poisoning.
Wow. I've not heard of that. I got to look into that. That's crazy. Okay, moving on to the next one. Mushrooms. For a long time, because mushrooms were under this, and still are, under this federal ban, most of people's experiences would be, taking mushrooms in sort of a party, recreational setting, other things like that. As the federal ban on research came out, you had people like Dr. Roland Griffiths, who's been on this podcast before, talking about some of their work with smoking cessation, end-of-life care, other things like that. What are your thoughts? I'm kind of separated a little bit. What are your thoughts about psilocybin in sort of an assisted or clinical setting that has a specific purpose or intention behind it, right?
So I'm very worried about it. And now, let me be clear, I'm not opposed to marijuana for everything. That end of life, it helps you eat, awesome. I actually got it for my father-in-law. For children who have seizure disorders that you can't control on other things, awesome. But let's not say it's good and teenagers should go out. And,
you're talking about marijuana specifically.
Marijuana.
Right now. Yeah.
But we have seen this show before with psilocybin when Valium and benzos first came out. Oh, mommy's little helper, they're innocuous, and they're clearly not innocuous. Benzos hurt a lot of people. Once you start them, you can't stop them. Opiates, and this came out in the 90s, that, if you have chronic pain, pain should be the fifth vital sign, and we should do everything we can to decrease people's pain. And then, thus, the opiate epidemic is killing a lot of people. Alcohol is a health food. And clearly it's not a health food. And I think mushrooms in certain situations can be helpful, but they're also harmful. And nobody's talking about that there are bad trips. There are people that start them and it can trigger an anxiety disorder. And I'm really worried we're going there before we go to teaching you not to believe every stupid thing you think, or dealing with trauma with a technique I love called EMDR, eye movement desensitization and reprocessing. When I do it with patients, I'm like, now, this is like being on mushrooms without the side effects. It's so powerful. And then I was a huge fan of Will Smith. He did a movie called Concussion, and I was a consultant on the movie. And I loved him, and I loved everything. So when his autobiography came out early 2022, I read it right before the Oscars. And at the end of the book, he talks about going to South America and doing ayahuasca 14 times. And I'm like, well, it didn't fix anything because, then, the thing at the Oscars happened at all.
Or maybe it did, and he still had some demons that were, left that were there.
I don't know. See, for me, it's like, let me look at your brain. Let me balance it in the least toxic, healthiest ways. And then let's see what else we need. But what the mushroom thing is going to do, just like the ketamine thing, just like marijuana, is a quick fix without getting the baseline strategies of health in place.
Yeah. I feel like
and that's my worry.
Yeah, that's the worry. That's the concern.
That's
as it becomes
my
more
worry.
popularized, people look at it as like a pill for an ill. Yeah. I would say that just my own sort of personal viewing of the landscape is that I definitely know that there's bad trips. Like the big survey that was done by Dr. Roland Griffiths, his estimation was about 8-9% of, based on their national survey that they did, are actually bad trips. And he is the first person to say and tell people like bad trips happen, right? Like bad trips are there. When I've seen people who eat healthy, live healthy, do these other things, are not looking at their only component, it does seem to be that these people that are out there talk about it being one of the mystical experiences that are in their life. Now, I hear what you're saying, which is that, okay, but do we need that? And what are the downstream effects, potential negative effects of going through that? And could there be something else that's better, like EMDR?
And it's in its infancy. So when you get on board too quickly, there are problems with that. Now, I've actually always been a fan of legalizing drugs. Please don't put people in jail for that behavior. It's a complete waste of resource. Let's learn about it. The imaging work I've done before and after, and my doctors here at Amen Clinics have done before and after, shows it decreases blood flow.
That's like on an individual level, no study yet like you did with marijuana, but maybe one day you'll do that?
Well, I actually did. One of my patients who I just dearly love, I have his brain, I think 2010, and it was hurt because of a traumatic brain injury, and he had addiction issues. And then hyperbaric oxygen, which I'm a huge fan of, supplements. 5 months later, his brain's better. 5 years later, it's normal. It's awesome. And then he's like, I'm going to go do a documentary on Ibogaine and take that. Let's do a before and after scan. And his before scan was awesome. And his after scan was awful. And I like begged him, I'm like, please don't do that. Don't ruin the work we've done. But
one question for the folks that were that you did the study with marijuana, you said 1,000 people that were there. What was the threshold of people being a part of that study in terms of how much were they smoking? I think I don't smoke and I've never really been into marijuana, but I think a lot of people who are listening would be curious about that. Like, how frequently were these people smoking or using marijuana?
They got a marijuana use disorder. So it was not 3 times a year. It was something that was impairing their life.
Got it. So these are like people who are smoking multiple times, maybe even a day. Okay.
Yes.
Got it. All right. Okay, moving on from some of those.
And, one principle I think we should talk about.
Please.
If I'm going to do something that may be bad, can I overcome that by doing all the right things? So, for example, I did the big NFL study. when the NFL was lying, it had a problem. So this was back in 2008, 2009, 2010. High levels of damage. Like, stop lying about it. Playing football is a brain damaging sport. But one of my players had an $88 million contract. So he was going to play. And it just reminded me, is if you're going to do something that's not necessarily great for your brain, you should be doing everything else right. It's like, why did Tom Brady play at an extraordinary level until he was 45 years old? Well, if you read his book, TB12,
I know very well.
Every other thing he does in his life is right. From going to bed at 9 o'clock to not eating crap.
Hydration.
Everything he did. And so I'm like, if you're going to do something that's not great, make sure everything else you're doing is great. And that helps to soften the blow.
So the book has plenty of things in terms of things that you could do to better the brain, right? Soften the blow. We'll get into those. But one more thing I want to talk about, which I think is still fascinating to this day, I've probably fell in this category too, on another thing that hurts your brain. You wrote inside the book, we have to ask people 10 times whether or not they had a head injury. You know, you talked about the NFL. Obviously, people understand in that context now, right? Regular traumatic head injury and the challenges it has, but talk about why you had to ask normal, everyday people like me and you, why they had a head injury like up to 10 times.
Because they forget. Like big things, they forget. And I had no clue. Like, I mean, I'm an Army-trained psychiatrist. I did my training at the Walter Reed Army Medical Center in Washington, D.C. And so if you're treating a lot of service people, head injuries are a big deal. And so we were taught, have you ever had a head injury? And then we believed them, yes or no. And then when I started scanning in 1991, you can see brain trauma very clearly on scans. It's, you know, generally decreased activity. It might be in the front and the back because of this thing called a Contrecoup injury. And you would see the evidence on the scan, but they would say no. And the first time this happened, I mean, it was so clear. I'm like, well, are you sure? I said, I don't think so. And then I'm thinking, well, what are all the ways? Have you ever fallen out of a tree, off a fence, dove into a shallow pool? Have you ever been in a car accident? Have you ever had concussions playing sports? Have you ever run into a plate glass window? And he looked at me and he said, oh my God. When I was 7 years old, I fell out of a second-story window. Do you think that counts? Or I had this one guy, it was my favorite story on this, is he had Tourette's syndrome, which is a tic disorder. And because he had a tic disorder, to get scanned, you have to lay perfectly still for about 15 minutes. And he had a tick, so that messes up the scan. So I actually took off my wedding ring and my watch, and I got on top of him in the camera, and I held his head for 15 minutes still. And afterwards, and he was going through drug withdrawal, I'm like, you know, now that we have this close personal relationship, stay and we'll look. He had a very clear head injury to the left front side of his brain. And I'm like, have you ever had a brain injury? And he said no. And he was sort of irritable because he was in withdrawal. And I'm like, are you sure? And now I sort of irritated him. And he's like, F no. But I grew up in the grocery business. Swearing never bothered me very much. And I'm like, ever fall out of a tree? F no. Off a fence? F no. Dive into a shallow pool? F no. Concussion playing sport? F no. Oh my God, I lied to you. I'm like, what? He said, about 5 years ago, before my addiction started, I was riding my motorcycle around a lake, and a baby deer came onto the road, and I didn't want to hit the deer, so I spilled the bike on my left side and broke my left jaw.
Mm.
He said, "Do you think that counts?" F yes, I said to him. Undiagnosed brain injuries are a major cause of psychiatric
You said number one,
growth.
right? Would you say that's
It's
number
the
one?
single most important lesson I've learned
Yeah.
from
Separate from
200
schizophrenia and, you know, that sort of thing. But
yeah.
it's the
I
number
mean, there's
one.
so many great lessons, but Predictor had. And as much as I loved football, I mean, I played football.
Did you think that everything that came out about the NFL and head injuries and the scans and what your work you did, and like the NFL is doing better than ever, and I have no judgment on it one way or another, did you think that it was going to have an impact in terms of people, you know, watching the sport, their interest in the sport? Just curious.
Pop Warner has gone down by about 50%.
Pop Warner?
Pop Warner. So little kiddie football.
Okay, got it.
And educated parents are not going to let their children play.
Got it.
Why would you? So if the brain creates everything, right? It's involved in everything you do. And when it works right, you work right. And it's soft, about the consistency of soft butter, tofu, custard, somewhere between egg whites and jello. And it's housed in a really hard skull that has sharp bony ridges. So your brain helps you be successful in life. It's soft and housed in a skull with hard, sharp bony ridges. Really? You're going to let your children? Because they may be the ones taking care of you. You're really going to let them potentially damage their brain? It's just not wise. And the NFL has done a better job of taking the head out of the game. But, you know, even during the playoffs, we've seen wicked brain injuries. And so I believe if you're going to do a bad thing for your brain, you should be rehabilitating it all the way along. And football's not the only brain damaging profession.
Sure.
Firefighter is a brain damaging profession. Our foundation supports a lot of firefighters because they have head trauma, they have toxic exposure, and they have emotional trauma. I mean, almost all the firefighters that I know have a level of emotional trauma from what they've seen.
I want to pivot to another thing that you're putting the spotlight on. You've done in other books as well, sleep apnea. Talk about why sleep apnea is so much more than what people think of, like the classic older, overweight individual who, you know, very clearly is like snoring loudly at night, right? Like that's very clear. But there's a whole other group of sleep apnea that people are totally missing out on.
Well, and one of them's in children. That when I was growing up, it was actually very common to take out your tonsils or adenoids if they were impairing your airway. It's much less common now, but if your kids snore at night, they have a higher incidence of ADD because their brain's not getting properly oxygenated. So that's what's really important. Your brain is the most oxygen-hungry organ in your body. It's 2% of your body's weight, but uses about 20% of the blood flow and 20% of the oxygen. So whenever you're in an oxygen debt state, it's harder for you to think. So people who have sleep apnea often look like they have ADD, even though they didn't have it as a child. They are more likely to be overweight and have trouble losing that weight as hard as they try. And they irritate their partners a lot.
a lot of different theories on this, but I don't know if you read James Nestor's book, Breath.
I have.
Yeah,
I love
and
that book.
One of the biggest things that he talks about is that, you know, the narrowing of our jaws that has happened through a combination of industrialized, you know, diets, and that putting a lot of pressure in how we breathe, and a whole generation of kids now that then became adults are, you know, mouth breathers instead of nasal breathers.
I think, didn't he talk about taping your mouth
Doing
shut
mouth
at
taping.
night?
Yeah, we're a big fan of it. My wife, when we came together, I was telling you I got married last year. She was a mouth breather at night. And I was like, babe, I know this is gonna sound crazy, but I'm gonna start taping your mouth at night. And it's because I love you. And it's worked wonders. She feels so much more focused the next day because it's just forcing her to breathe through her nose.
That's so interesting. And if you breathe right at night, you think right the next day because your brain has been properly oxygenated.
Yeah.
And you know, who would think about that physical function can impact your mood? So maybe it's not mental health, maybe it's brain health. And I love breathing. I have in the book, I talk about the 15-second breath and how to almost immediately break a panic attack. 4 seconds in, hold it for 1.5 seconds, 8 seconds out, hold it for 1.5 seconds, 15-second breath. You do that 4 times, your anxiety drops like a rock.
I love it. It's a great recommendation. I remember seeing it. One of the things you talk about in this book, and you've shared in other books, is this idea of like understanding your brain type, right? Walk us through that. And how did you come up with what these different brain types are? And then what implications do they have in terms of personalizing this approach to ourselves?
Well, when I first started scanning people, I was looking for what does depression look like in the brain, or what does ADHD look like in the brain, or OCD. And I was sort of looking for the one pattern that would help me make a diagnosis. And early on, I realized none of these have one pattern. They all have multiple types. But people who had healthy brains tend to have healthy lives. People who had low frontal lobe function tended to be more spontaneous and impulsive. People who had high anterior cingulate, so it's deep in the front part of the brain. When that was busy, they tended to be worried, rigid, and flexible. Things don't go their way, they get upset. And I'm like, so I've written whole books on 7 types of anxiety and depression, 7 types of ADD, 6 types of addicts, 5 types of overeaters. And then I went, this really tells us what kind of person you're going to be. And so I developed a brain type assessment to help me assess, without a scan, which of the 5 primary types you are. So balanced, healthy brain, spontaneous, sleepy frontal lobe, sort of my ADD group, persistent, high frontal lobes, my OCD-ish group, sensitive, their limbic brain is active, and cautious. Their amygdala, basal ganglia tend to be cautious. And there's a total of 16 types. From 6 to 16, it's combinations, so 2, 3, 4, and 5. And it's so helpful just to know, well, I tend to be cautious, or I tend to be sensitive, or I tend to be spontaneous. And then, well, what are the behavioral strategies and what are the supplement strategies?
And is the goal for everybody to move towards a balanced brain? Are there natural
Not
sort of archetypes
necessarily.
in society where people are going to have just, different variations, and some people are going to be more creative and spontaneous?
Yeah, no, I think the goal is to be your best self with the healthiest brain. And as you move toward more balance, you tend to be emotionally more balanced.
All right, before we conclude on some mindset related questions as we wrap up the interview, I want to ask you about a topic that was in the book. You've written about it before, but it always gets people's attention. How can improving your brain health improve your sex life?
Whatever is good for your heart is good for your brain, because your brain gets 20% of the blood flow. And then in 2007, I wrote a book called The Brain in Love. And I'm like, oh, I missed something. Whatever's good for your heart is good for your brain is good for your genitals, because it's about blood flow. And one of the things I've noticed over and over and over and over is if someone goes on a brain health program, their erections get harder. They get better. They get more consistent. And why is that important? Because your love life is critical to happiness. And 40% of 40-year-olds report having erectile dysfunction. That's horrifying to me. And 70% of 70-year-olds have erectile dysfunction, which is why on the news we see all the commercials, or on TV we see all the commercials for Viagra, Cialis, Levitra. We have a serious erectile dysfunction problem in the United States. And I think it's tied to metabolic syndrome and obesity and diabetes. But when you get your brain right, your love life gets better physically. But what I often say is you have no forethought, there's no foreplay. That ultimately a healthy brain gives you better decision making, allows you to listen better, gives you better empathy, which means odds are you're more likely to get lucky. It seems like we are bathed in a toxic soup that we have to be really careful with. And, as I think about this, I have never seen the number of young men have low testosterone levels than I am now. In the 40 years I've been a psychiatrist, I've never seen that. And why would that be? And I think it's the plastics, and it's the toxic products that people are putting on their body. We talked about the Ultramind solution. Ultimately, I created my own mnemonic for integrative medicine and psychiatry. It's called Bright Minds. If you want to keep your brain healthy or rescue it, if it's headed for trouble, you have to prevent or treat the 11 major risk factors that steal your mind. Bright Minds is the mnemonic. B is for blood flow, R is retirement and aging, I is inflammation. The T is toxins. And we live in this toxic soup. So, for example, when I was growing up, I never put sunscreen on. And now children are bathed in sunscreen. And it just came out recently that several makers of sunscreen had carcinogenic ingredients in their products. So isn't that horrifying, right? That I'm protecting you from skin cancer and giving you another kind of cancer. And I think this toxic issue is so important. Now, they had it 40 years ago, 50 years ago. I was, before I read a book called The Toxin Solution by Joe Pizzorno. Loved it. And I started scanning all of my personal products with the app Think Dirty. And you probably know that app. On a scale of 1 to 10, how quickly is a product killing you? And I've been shaving with Barbasol for 50 years. On a scale of 1 to 10, 1 is good, 10 is bad, it's a 9. For 50 years. And so now I shave with something called Kiss My Face, and it's a 2. And it's cheaper because it lasts like way longer. But if it was more expensive, I wouldn't care because it's me. I love me. Why would I put anything toxic on my body if I could help that? And so I'm not sure I'm doing a good job of answering your specific question.
I think if I could just interject, I think that, one of the things you're hinting towards is that there are more toxins, both physical toxins and also, I would say, psychological toxins, just like you were talking about the news earlier, and some aspects of social media, although there's a lot of great aspects of social media too. And because we're more bathing in this soup, we're just more surrounded by things. So on some level, we have to be a little bit more diligent than people who weren't surrounded by this physical and psychological toxins.
Well, and with the psychological toxins, the news, any bad thing that happens in the world, immediately, which makes you think things that are very uncommon are common, and that is stressing all of us out.
So on the topic of toxins, you mentioned another toxin earlier that you've shared about before, and it's another environmental toxin that is starting to get a lot more attention, but for a long time, I would say that a lot of people either completely ignored it or thought that focus on it was uh, lunacy, if that's a word. And that is mold, environmental mold toxins. I want to have you break it down for the folks that are not as familiar. How is it that mold can wreak havoc on the brain? And what are the most common ways that people are being exposed to this toxic level of mold on a regular basis?
So it's like, why does a psychiatrist care about mold? I mean, it's an interesting question. I didn't learn anything about it in my residency. Didn't hear anything really about it in medical school. And I started seeing these scans that looked damaged, that looked shriveled. And it's sort of so early on when I started scanning, I was the director of a dual diagnosis unit. That's a psychiatric hospital unit that takes care of drug addicts and alcoholics. And all of their brains look terrible. Like the real reason not to use drugs is they damage your brain. But then I would get these people that had damaged brains, just like cocaine or methamphetamine or alcohol problems. And they swore up and down they weren't drinking or using drugs. And then I'm like, well, what else could cause that? And, ultimately it's 10 things that could cause it. And one of them is mold. And I had this patient I just dearly loved. And she's like, I can't think. And my kids, I think all of my kids have ADD, but they didn't have ADD last year. And my one son can't do his homework at home, but when he goes to his friend's house, he can do his homework. And I'm like, did you guys have a flood? And they had. And I'm like, oh my God. And we tested her. The home was loaded with mold. She was loaded with mold. And it just helped me to realize mold is a neurotoxin that can literally damage your brain. And then one of my favorite stories is Dave Asprey. Based on my work, he got a SPECT scan. It was moth-eaten, and he wasn't drinking or using drugs. It turned out he had mold in his home. And as he remediated the mold, he got better and then went on basically to become a brain warrior and, is the founder and CEO of Bulletproof.
No, that's a great story. And we've had Dave on the podcast before, and he's given you a lot of credit for that role that you've played in his journey and his health. And it's just another, mold has been something. Mold's mentioned as Dr. Ann Shippey, who's been on the podcast before, reminded me that she said mold's been mentioned in the Bible. It's a long history of people understanding that mold has been out there, and we used to actually be very diligent of paying attention to it because you really couldn't, at least with the way that buildings were built. And much like death before, it's easy for mold to just hide in plain sight and be there in our modern houses, which is my understanding of where we're mostly getting this exposure to extreme amounts of mold. And with severe flooding and weather being continuing to be an issue, and the way that houses are being built, it's one of those things that if you've been having some of the symptoms that people often talk about, like you mentioned earlier, that are related to mold, it's worth digging into, because even people who are in this industry, like my own business partner, Dr. Mark Hyman, he had mold for years and he teaches this stuff, and he never thought it would be his place because of how it was built. And then finally found out through investigation that it was his place, and had to remediate the whole barn that his house was based in. Now, on a message of hope, because we're talking about these brains being damaged, we obviously know Dave's story a little bit, but tell us about some other patients that you've worked with. When you see damaged brains, whether they're coming from toxins, mold, which are the ones that really there should be a message of hope for, that, you can change your brain and you can make progress and you can repair, and which are the ones that you can still improve, but are a little bit harder to make headway on?
Well, when you damage your frontal lobes, it's harder to do the right thing consistently. And that's why I love the scans, because I can show you the trouble. And if you do what I ask you to do, I can actually show you how much better it can be. But when you damage the frontal lobes, it's hard for people to follow through. And, I work so hard to get people to sort of buy into the whole BrainMD concept, and then day in and day out to make good decisions. And sometimes it's hard for people. But when they have hope, and then we know we're going to do a follow up scan like 3 months from now, it lights a fire under them a bit. And, every day your brain's getting better, it's getting worse by your behavior. If we can help them feel better quickly, they're more likely to stick with it. Obviously, the earlier you get it, the easier it is to fix. But we have so many great stories. I have this one guy that he thought he had Alzheimer's disease, and his brain looked awful. But when he saw it, he just did everything I asked, and a year later it was better. I just scanned him again for the third time. It was 3 years later, and I have brain envy. He has such a beautiful brain that he and I both celebrate that your brain can be better 10 years from now than it is now. How exciting is that? Now, it's going to take 10 years worth of good decisions, but who doesn't want that?
Let's talk about the eye, the inflammation piece that's there. It's one of our biggest areas that people search for, especially on YouTube, and have interest on, because the word is finally getting out there, kind of like the microbiome. More people are paying attention to it and understanding that when inflammation gets out of control, it can literally burn the body from the inside out and cause all sorts of, or be linked to all sorts of chronic diseases that are there. So on the inflammation piece, every single one of the toxins that we covered and all the things that you've mentioned previously can contribute to inflammation. Head traumas, mold, plastics in the environment, anything that makes our brain or body say ouch can be a contributor to inflammation. But let's talk about the part that is the co-pilot to that, which is cooling off the fire. What do you want people to understand when it comes to the things that they have control over that can significantly make a difference in reducing the out of control inflammation in their body?
So, I generally think of inflammation in three big things. I think of your microbiome, because when it's not healthy, you have more inflammation. I think of gum disease, and I think of low levels of omega-3 fatty acids. I did a study looking at 50 consecutive patients to Amen clinics who were not taking fish oil, and 49 of them had suboptimal levels of omega-3 fatty acids. We do the omega-3 index in our clinic developed by Bill Harris, and I was horrified by the low levels of omega-3 fatty acids. Well, how easy is that to fix, right? Take a high quality omega-3 every day, supplement, get more omega-3s in your diet, and begin to limit the unhealthy omega-6s from processed food, especially corn and soy. So supplementation, omega-3s in their diet. Gum disease is a major cause of inflammation. And quite frankly, I didn't care about my own gums until I started reading the research on gum disease and heart disease, gum disease and dementia, gum disease and depression. And I'm like, so ultimately became a flossing fool. And even though one of the good things about dying is I'm not going to have to go get my teeth cleaned, I go get them cleaned twice a year, just to make sure I'm on top of it. And then really falling in love with your gut bugs. I call them friends with benefits, that they make neurotransmitters, they digest your food, they help detoxify your body. I think the more we can elevate the microbiome to an everyday discussion, that's just a really good thing to do. Do I love my gut bugs? And this is why you don't drink alcohol. What does alcohol do to bugs? It kills them. My wife's a nurse, and why does she put alcohol on your skin? because it disinfects it. Why, during the pandemic, did Jim Beam make hand sanitizer? Because alcohol kills bugs. So you really want to be drinking 2, 3, 4 drinks every night. What's that going to do to your microbiome? It's not a good thing. Artificial sweeteners like Splenda, some evidence it can damage your microbiome. Pesticides, what do pesticides kill? Bugs. Antibiotics, what do antibiotics kill? Bugs. So I think just being more mindful of the microbiome will help decrease inflammation. And I don't know, Drew, if you've noticed this, but it's autoimmune disorders are rampant. And every night, every Thursday night during the early part of the pandemic, I was on the radio in London just answering questions from callers who were anxious. And I remember this person called with rheumatoid arthritis, and I was on with an ENT doctor. And the host kept going to the ENT doctor about this person's rheumatoid arthritis. And I'm like, hello, psychiatrists are physicians. Why do you have rheumatoid arthritis? That is what you have. It's not why you have it. And if you don't know why, you really can't treat it. And I get really irritated because I have so many patients come in, they have Sjogren's or they have rheumatoid arthritis or something else. It's an autoimmune disorder, which just basically means you pissed off your body and it's now friendly fire. It's attacking itself. And they're not thinking about the simple things like, maybe we should stop gluten and dairy, corn and soy and artificial dyes and sweeteners and just see what happens. And I have all of my patients who have autoimmune disorders keeping journals on, okay, which foods make me unhappy and which foods make me happy. And it's so simple.
Simple. And when you invest in your body and you also invest on identifying those dragons of the mind, a lot easier to keep your focus on those things and have longevity, because people get derailed. When you put people on a plan, or when you see people pick up your book and actually read it, what would you say would be the most common reasons that you find, even if you talk about them and sort of help people know in the context of the conversation, what are the common reasons that people get derailed that you see from following through with a program or plan?
They're not really clear on the why of what they're doing. Because I find if you don't really know why, you won't do what. And, people go, so what do you think's one of the secrets to your longevity and success? And I have an exercise I do for my patients, but I always do it for myself, called the one-page miracle. It's on one piece of paper. I write down what I want: my relationships, my work, my money, my physical, emotional, and spiritual health. What do I want? And so I'm like always crystal clear. And I think people should run their lives like really great CEOs run businesses. And it starts with, so what's your mission? And how are you going to get there? And what do we have to do day in and day out to do that? And it's that level of clarity that prevents people from getting off track. So if I know, for example, I want to have a kind, caring, loving, supportive, passionate relationship with my wife, I inhibit a lot of the stupid things I think. I don't let them out of my mouth because it won't get me what I want. If I know I want to live until I'm 100 with my brain intact, that if I want to live with energy and clarity and good decision making, like I love my 4 children, I never want to have to live with them. I don't want them dressing me, changing my diaper, feeding. No, I want to be independent. And if I know that, I'm going to be making better decisions. and I'm going to stick with it. And too often people start because they're like, okay, my jeans are too tight or I hurt, but they don't really have the complete picture in their head of why they're here and how they want to live the rest of their life.
And what you want changes in different age ranges that you're in. What's something that you want now, being a young 67, that is new for you, that's a priority in your life, either based on your environment or based on the health goals that you have today? Something that you want now that maybe you didn't have at the highest level of priority. Not that it wasn't a priority, but it wasn't at the highest level of priority in the past.
Well, I love grandbabies as opposed to wanting babies. I don't want babies anymore. 10 and I last year ended up adopting our two nieces who are now 11 and 16. And they're the last babies for us. We love them, adore them. But, I sort of want mostly the same things: energy, meaning, and making a difference. I guess I could retire, but to do what? I love what I do so much. Like, just having this conversation with you just makes me happy to learn and to give that to other people. At my age, you begin to think about, how do I get this to live beyond me? And so I love training other doctors to do what we do. One of our big goals, and it's also one of the reasons why I want to live a long time, is I want to change how psychiatric medicine is practiced. I think psychiatry has completely lost its way. And, when I trained, we were sort of primary care doctors for the mind. We'd see our patients for an hour or two, or sometimes 3 or 4 hours a week. We'd really get to be involved in their lives. And now psychiatrists have become prescribers. You go to somebody else for the therapy and we'll do your medication. It's complete nonsense as far as I'm concerned. Plus, most psychiatrists never look at the brain. So, we really haven't talked much about that. But psychiatrists are the only medical specialists that virtually never look at the organ they treat. And for 30 years, I've been looking and sort of like the wolf crying in the wilderness, scan your brains, scan the brains of your patients, because if you don't look, you don't know. And, I've had that goal to change my profession. And just in May, the Canadian Association of Nuclear Medicine came out with procedure guidelines for SPECT, as if I wrote them. In fact, of the 10 authors for the guidelines, 5 of them had been my students. And that made me super happy. But, if you're going to change a medical specialty, it's going to take a long time and a lot of effort. So training other doctors to do what we do is a high priority for me.
I want to jump back over to the practicalities on things. And I think there's a lot of people that are asking this question when you were chatting about some of the topics earlier that I'm going to bring back. On the topic of alcohol, so is it that you don't drink at all? And then with your patients, are you telling them, in addition to your thoughts, that, look, I'm recommending not drinking at all based on everything that I know and put together? Is there another part of you that says, okay, great, if people are going to drink, here is the max limit, or here is the better options that are there? So just a clarifying point from your perspective.
So I don't drink at all. I don't ever like not being mentally clear. And
could I interject 1 second just to clarify that? Has that always been the case, or did that change at some point in time in your life?
I got drunk when I was 16 and acted badly and felt badly for a couple of days. Tried it again when I was 21, and I'm just like, I don't get it. I just never really got it. And then when I saw the scans of my alcoholics, I'm like, well, that's horrifying. And then I just sort of followed the research. And my biggest blog last year was called I Told You So. And I started the blog with when I was dating my wife, she told me, I will never tell you I told you so. And she lied. It's like her favorite thing to say. And for 30 years, I've been saying alcohol is not in your best interest. You know, you can imagine as a psychiatrist, I see a lot of couples with domestic violence and people who make bad decisions, and alcohol is involved in a very high percentage of cases. But last year, the American Cancer Society came out against any alcohol. Imagine that, a political body like that. And they said any alcohol is associated with an increased risk of 7 different kinds of cancer. And so if any alcohol shrinks your brain, study from Spain recently, destroys the white matter in your brain. I published a study showing it prematurely ages your brain, and it's associated with cancer. Chemotherapy is not good for your brain. If you're sort of a drinker and your brain is super healthy, what am I going to say? Most of the people who come to me, their brains are not healthy. And I'm like, oh, well, we need to rehabilitate your brain. And during this time, until your brain is really healthy, I would prefer you not to drink. If you're going to drink, you know, maybe 2 glasses a week would be sort of okay. So that's generally what I tell my patients.
And again, I'm not a big drinker. I had very sort of liberal sort of parents growing up that said, here's the reason why we don't drink. But they understood that the more you try to control kids, the more that sometimes there's backlash. At least when it comes to alcohol and the American approach versus let's say the European approach. So I never really had a draw towards it. I drank a little bit. I had some. I think I had a beer once in high school. Didn't even finish it, and in college a little bit. Had like a couple cocktails and things, but it was mostly as an excuse of I'm out dancing, I'm hanging out with my friends, we're all having fun together, and so I never really got into it. But I know that people who and later on in life, I got a little bit into wine more as just an appreciation. I actually prefer to taste it rather than drink it. I'll take a little sip, and I have no problem spitting it out because I don't really enjoy that aspect as much as I just do the taste and developing that palate. So when you say a couple glasses a week, because I know people are thinking about this distinction, are you steering them towards certain alcohols versus other alcohols?
No, they're all equally problematic for you. So, and it's very important from a clinical standpoint to actually get a really good history of how much they're really drinking, because they'll say, oh, I only have 2 or 3, but you realize they're 2 or 3 big glasses. So they actually might be considered 8 or 10. So I think history matters. I was in the military and spent 3 years in Germany, and they have these huge beer steins. So whenever someone says, oh, I only have 3 glasses, my next question is always, how big's the glass?
It's a good question.
Yeah, and ultimately, it's about love. And I think a lot about teenagers. I'm also a child psychiatrist. And we developed a high school curriculum called Brain Thrive by 25, and it's in all 50 states and 7 different countries, where we teach kids to fall in love with their brains. And invariably, during, I think it's week 6, it's what to avoid. And, like marijuana and alcohol and not sleeping, bad food. And invariably, it's a boy. And it sort of frustrates me that it's always a boy that raises his hand and says, how can you have any fun? And then we play a game with the kids called Who Has More Fun? The kid with the good brain or the kid with the bad brain?
Who gets the girl and gets to keep her because he doesn't act like an ass? The kid with the good brain or the kid with the bad brain? Who gets into the college they want to get into? Who has the most meaning and purpose throughout their life, which is truly associated with happiness? The kid with the good brain or the kid with the bad brain? And we had an independent group study, Brain Thrive by 25, decreases drug, alcohol, and tobacco use, decreases depression, and improves self-esteem. It's not effective to say you shouldn't do this. It's really effective to get them to fall in love with their brain and then to take care of it. And I find youngsters today, teenagers and kids in their early 20s, are very interested in their health. And if they know why, they're more likely to do what is helpful for them.
You said you have a higher risk of heart disease in your family. Is that right? And then you looked at your own assessment. Is that what, through genetics, like certain?
No, my
certain
grandfather
SNPs?
died of a heart attack.
Okay, got it.
And
anything that
my
you've
father
seen?
had a heart arrhythmia. So I clearly have it. So,
And
but I don't have heart disease.
yeah. But it wasn't any genetic sort of, higher risk that came in from the genetic side.
No, I'm supposed to die of a blood clot.
Okay.
Which is why I take omega-3 fatty acids every day.
Got it. Well, I was going to go into, there's a lot of different people that talk about, what is good for the heart. You were sharing earlier, like what's good for the heart is good for the brain. Some people will say like, saturated fat, more than 10% of your diet is the devil because they believe in the cholesterol link to, atherosclerosis. And there's other people that say, well, we don't have enough data of that sort of healthy user who's not insulin resistant, who works out, who doesn't smoke and doesn't drink and has vegetables in their diet, and whether or not saturated fat is a problem for them. So I was just curious, just because you mentioned it earlier, are there any things that you've done as you are more protective of your heart health and things that you're making decisions on that you decided or not decided? Like, for example, like, do you actively go out of your way to reduce or avoid red meat in your diet, right? Or are you not worried about that? I'm basically looking for what is the Dr. Daniel Amen approach to all the data that's out there and the different folks that argue one way or another when it comes to heart health.
So I'm a fan of a healthy cholesterol. What a lot of people, so my unique spin on it is low cholesterol, under 160, is associated with depression, homicide, suicide, and death from all causes. Because cholesterol is the building block of a lot of the hormones that we have. And so this beat the drum, low cholesterol, low cholesterol, low cholesterol is nuts as far as I'm concerned. Now, you don't want high of the bad cholesterol, but LDH, people think of, or LDL, that's the bad cholesterol. No. It's critical cholesterol, but there's fractionated parts of it. They're the big fluffy A particles, which are pretty much innocuous, and the little tiny B particles, which are really problematic because that's what causes atherosclerosis. So the total number is not nearly as important. My cholesterol always tends to run a little high, but my HDL is like 90, which is, what people think of as good cholesterol. I think red meat, it depends. If you are eating grain-fed red meat, that's probably pro-inflammatory and bad for you. If you're eating naturally raised red meat, grass-fed red meat, probably good for you unless you're like me and you have high ferritin levels. So ferritin is a measure of iron storage, and high ferritin, premature aging, it's one of the aging risk factors. And so I have to go donate blood, which I was thinking of doing it this weekend, donating blood on a regular basis to keep my ferritin in a healthy range. Now, if you have low ferritin, you're probably having trouble sleeping, and you're probably anxious and you look like you have ADD. So you want to keep it in a healthy range, somewhere between like 40 and 70. There's new work on the ketogenic diet for mental health.
Yeah. Are you talking about Dr. Chris Palmer or?
Yeah.
Yeah. We had him on the podcast just recently.
Oh, I love Dr.
Yeah.
Palmer.
Have you guys connected before?
I did an Instagram live with him.
Oh, that's amazing.
Because I've been a fan of the ketogenic diet for a long time. And I have a granddaughter who turns 12 tomorrow, who's basically been on it since she was 9 months old. It's miraculous for her seizure disorder. And I'm like, well, I use anticonvulsants all the time in psychiatry. If you have bipolar disorder, if you have temper problems, if you have mood swings, it tends to level people out. Well, if you can use a natural anticonvulsant diet, ketogenic diet, why not think about that? We eat way too many simple carbs in this country. And when people go on a ketogenic diet, they're not hungry. I mean, it's like one of the huge benefits of a ketogenic diet. But it's tricky, right? I mean, you really have to think. Because people go, oh, I can just eat all the meat I want. It's like, no, ketogenic diet is, and the more liberal ones are called 2-to-1. It's, you need twice the amount of fat as you have carbs and protein. That's tricky. And so you end up with a fair amount of saturated fat in that. And there's studies showing it helps with long COVID. There are studies that show can increase longevity, that burning ketones is more efficient and better for your mitochondria than burning sugar.
Yeah. We didn't talk about sugar, but that's probably another one of those things, high consumption of sugar in our diet, insulin resistance, that has a lot of detrimental impact on the brain.
Well, the D in Bright Minds, we haven't talked about it much yet, is diabetes, where you're overweight and have high blood sugar. Either one of them is a risk factor for Alzheimer's disease. But when you put them together, you have 7 of the risk factors. If you are overweight or obese, you have low blood flow to your brain. Your brain looks older than you are. You have inflammation because fat cells produce something called inflammatory cytokines. Fat stores toxins. It changes your hormones. Fat on your belly takes healthy testosterone levels and turns it into unhealthy, cancer-promoting forms of estrogen. You're also more likely to be anxious and depressed, and then you have diabetes, the diabetes risk. I'm like, oh. And I published 3 studies. First on my healthy group. So I have a healthy group. It's hard to find healthy people, just saying. Healthy overweight or obese versus healthy not, lower blood flow, especially in the front part of the brain. And then in my NFL group, I'm like, overweight or healthy weight? Overweight, less blood flow in the front part of their brain. And then last year I published a study on 33,000 scans. There was this linear correlation, healthy, overweight, obese, morbidly obese, lower, 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 lower. I'm like, no, 72% of Americans are overweight. And why I was furious with the lockdown, I mean, not to get political.
You can get political if you want.
Furious at the insane response to the pandemic. Not one thing out of the National Institute of Health. We are sick as a society. We need to work on getting healthy. Instead, they locked us down where people got fatter and more addicted. It was just the wrong strategy.
And now they want to give everybody Ozempic, including kids, especially kids.
It's the pharmaceutical industry is running things. And it's like, why would we do that unless we were just a bit insane?
Well, yeah, it seems like we are a little bit insane.
No, I'm not In the book, I talk a lot about if I was an evil ruler and I wanted to create mental illness, I think I have like 20 evil ruler days in the book. What would I do? And I'd have that response to the pandemic. I wouldn't, what should they have said to do? Is if you're overweight, this is a great time to get healthy. If you have low vitamin D, everybody should get their vitamin D level checked. You should have your vitamin D level be mid-range or high normal. People who had healthy vitamin D levels died less from COVID. That's the cheapest intervention. But if you lock everybody inside where they're not getting the sun, you're dropping their vitamin D levels. And low vitamin D also goes with a smaller brain. I read that study. And when I first tested mine, and I live in Southern California where the sun's out a lot, it was terrible. And I'm like, but I'm inside during the day. I was never really thinking about it.
Yeah, super important. I hope that we learn from the response that we had for the future. I feel like as the media shifts and more people are listening to, going to like Instagram pages like yours, right? We have linked to your social media in the show notes. People can follow you. People are listening to podcasts, and people are getting their news source from different areas. They're getting a chance to hear the healthy debates. Doesn't mean that we have to all agree. I'm actually okay with polarity. Like, I want people to have disagreement about different stuff.
Yeah, but they blocked the people who had a different opinion. That's not America. It's like, how did they all of a sudden determine that free speech wasn't part of who we were as a people? It's my speech or no speech. Yeah, I'm still
for sure. And
really
it's good to see that shifting. I think we went one way, we went way too far one way. And so now you have a group of people that are, I know people have a lot of different opinions about them, but even like Elon Musk taking over Twitter, Apple was one company that basically said, like, because we don't make money on advertising, they didn't say this out loud, and this is the vast majority where people listen to podcasts from in my audience. And then there's Spotify, which also has very strong, freedom of speech rules. But Apple was like, we'll let anybody talk about anything. We're like a public utility for our podcast app. Like, we don't even, so people want to listen to whatever they want to listen to. Great. Like, we're not going to subvert the information, unlike, other social media channels that were there. Anyways, I'm kind of getting off a tangent, but I'm hoping that we learn some of the lessons.
What a time.
What a time. What a time. What do you think are some of the top couple or one or three beliefs that get in the way from people making progress on improving their health and their brain health?
It's hard. That's the first one.
That's the first one. It's hard. It's hard.
Everything in moderation. It's the gateway thought to hell. It's the gateway thought to cheating. It's expensive, where having an unhealthy brain is way more expensive because your decision-making goes down. I think it's hard. And if it just started with, is this good for my brain or bad for it? That's 3 seconds. So it's easy, and you just need to gather the information. And, whether it's your podcasts, Dr. Hyman's books, my books, so much of the content's free. But it's just, is this good for my brain or bad for it? And quite frankly, most second graders would get a 90% right. Like when my daughter was 7, I went into her second grade class and I wrote 20 things on the board. And I'm like, separate them for me. Good for your brain or bad for it. And I put marijuana and alcohol and playing tackle football and not sleeping, being in a home with chronic stress and multiple vitamin, taking fish oil, eating your vegetables. They got 95% right. The only thing they missed? Orange juice. They put it in the good category.
That's the power of marketing.
Yeah. No, my dad was a grower for Sunkist. When he heard me start going after orange juice, he's like, what's the matter with you? Someday the oranges will be yours. And I'm like, love oranges. No, on unwrapping fruit sugar from its fiber source.
There's another trap that we get into that you write about in the book, and that's these automatic negative thoughts. What are they? How do we identify them? And most importantly, how do we move beyond them running our lives? And for a lot of people, they are running their lives.
So there's nowhere in school where we teach children not to believe every stupid thing they think. Thoughts come from all sorts of places. They come from our genetic code. That if you have trauma in a past generation, you're more likely to be negative in this generation. They come from the voices of our mother and our father. They come from the voices of our teachers, our coaches, our friends, our foes. They come from the news we listen to, from the music we hear, and they lie a lot. And just because you have a thought has nothing to do with whether or not it's true. And I was 28 years old and had a fair amount of anxiety growing up. I used to bite my fingernails.
Which came from where, by the way? I know I'm going on a tangent, but that general sense of anxiety that you had, what do you think was the...
Well, two things. My grandfather, when he was 19 years old, his brother was killed in a train accident, and he thought it was his fault. And he was furious at his sister who lent him the car, and he held a grudge for decades. So I think some of that, but the other thing is I'm the second son in a Lebanese family. So, which growing up, you just sort of feel irrelevant. And I got beaten up a lot by my older brother. And like every video, home videos that my dad took, he's beating me up. And when I'm 50, I went to my dad and I'm like, why didn't you stop him? He's like, somebody had to take the movie, which I just thought was complete crap. And so I think that sort of set it up. But helped me with the fight that I've been in for the last 30 years with my colleagues about psychiatry is broken, we need a better way. Anyways, I'm in my psychiatric residency. I'm 28 years old, and a professor said, you don't have to believe everything you think. And I'm like, holy shit, I've always believed everything I thought. And one day, how the ANT thing came about is, it's about 1991. I had a really hard day at work. I saw 4 suicidal patients, which is a lot. And 2 couples who hated each other, 2 teenagers who ran away from home. And I went home and I remember feeling tired. And I came home to an ant infestation in my house. And I'm like, seriously. And I was cleaning up the ants. I began, because when you're a medical student, you have to learn 50,000 new words, and you're always making up mnemonics and acronyms. And I'm like, automatic negative thoughts. My patients are infested. And the next day, I brought a can of Raid to work. And I put it on my coffee table. I said, I'm going to teach you to kill the ants today. You don't have to believe every stupid thing you think. And then over time, it morphed. I went to Pier 39 in San Francisco, and I found an ant puppet and an ant-eater puppet, and I would play with that because I'm also a child psychiatrist. And it's one of the most important things I do with people. Whenever you feel sad or mad or nervous or out of control, write down what you're thinking. Because the act of writing helps you get it out of your head. And then I have 9 different types of ants. I talk about it in the book, like fortune telling, mind reading, labeling, guilt beating, blaming. Identify what kind of ant it is, and then talk back to it. Now, were you any good at talking back to your mom and dad when you were a teenager?
Yeah.
I was excellent. Both my parents would tell you I was excellent. But nobody ever taught me to talk back to myself. And I've been picked on a lot by the media, which is frustrating. I don't like it. And recently, I got picked on again. And I'm like, I hate this. And so I wrote that down. I hate this. And then there's 5 questions. Like, is it true? Yes, I hate this. Is it absolutely true? No, because I keep doing the things that bring negative attention to myself. You know, if you're going to be in a war, you have to be able to have armor. And so I'm like, no, not absolutely. How does it make me feel? Anxious. How would I feel without it? Normal. The 5th question is the best question. It's take the original thought. I hate this. Turn it to the opposite.
This is like Byron Katie's work type thing?
It is.
Yeah, okay.
But a bit on steroids.
Okay.
And it's like, I love this. And then focus on, well, which one's really true?
Mm.
And I love being in the fight of changing a medical specialty. I actually have done a lot of work with Byron Katie and have her scan, which wasn't healthy. But then it was. But she's the most peaceful person. And you find when you don't believe your thoughts, you don't suffer.
There was this pivotal moment in your life that you realized that improving your brain health improved every other aspect of your life, and the two were deeply connected. Expand on that a little bit if you could.
You know, I started looking at the brain 30 years ago. And here I am. It's 1991. I'm a double board certified psychiatrist. I was the top student in neuroscience in medical school. And I'm 37, and I don't care at all about my own brain. And then the week before I scanned my mom, we do a study at Amen Clinics called SPECT that looks at blood flow and activity. And she just had the best brain I'd ever seen, which was a reflection of her life, the most consistently loving, reliable person on the planet that I'd ever met. And then the next week I scanned myself, and it wasn't good. And it wasn't good because I played football in high school. I had meningitis when I was a young soldier, and I had bad habits. Like I didn't sleep. I thought I was special because I could get by with 4 hours of sleep at night. And I was sort of horrified by my scan. And then I realized, well, what if I made it better? And if it was better, would I have better energy? Would I have better focus? Would I have a better memory? And I just became obsessed with brain health, and it changed everything. I just turned 67, and I'm every bit as energetic and as sharp as I was 30 years ago, probably more so. And my scan has gotten better over the years. And it really became the foundational message for Amen Clinics. You're not stuck with the brain you have. You can make it better. And with a better brain, everything in your life is better. Your relationships are better. Your work is better. Your money's better. Your health is better because the brain is the organ of decision making. And if you make better decisions, the rest of your life will be better. And nobody cares about their brain, like me, because they never look at it. But once you see it, you can't unsee it. And I've just loved this journey that we've been on.
As a young adult and then a young, physician, what were some of the beliefs that you had about the brain that you've been spending your entire career to help people realize are maybe not true, or not true in the way that they thought they were true? But yet still, a lot of people who are watching and listening might still have some of those beliefs. So let's talk about them. What were some of the beliefs that you had about the brain that you were told or heard in society, or maybe even trained about as a physician early in your career that turned out to not be the full picture and story?
Well, that the brain cannot change. In medical school, we were sort of like, if you have brain damage, it's not coming back. That the brain doesn't continue to make new neurons throughout life. And that's just not true. every day your hippocampus on the inside of your temporal lobe, super important part of the brain, makes 700 new baby stem cells every day. The brain can change in tomorrow. If I sleep better tonight, my brain's better tomorrow. So getting the right habits in your life. Another big lesson is mild traumatic brain injury is a major cause of psychiatric illness, and nobody knows it because they don't look at the brain. I grew up playing football, loving football, until I started seeing the scans, including mine, of people who played football. Not a good thing for the brain. Another huge lesson was all psychiatric illnesses, anxiety, depression, PTSD, OCD, ADHD, whatever, are not single or simple disorders. They all have multiple subtypes. Giving someone the diagnosis of depression is like giving them the diagnosis of chest pain. We just have this thing in psychiatry so backwards that, you meet 6 of these 9 symptom criteria, you get a diagnosis, but it doesn't tell you one thing about the underlying biology of the brain. And then, the last thing I would say, just as we're starting out, I have always hated the term mental illness. I remember as a medical student, I thought it shamed people and it was wrong. These are brain health issues that steal people's minds. But if you don't look, you don't know. And part of our mission is literally to end the term mental illness and just call these brain health issues. Get your brain right and your mind will follow. And Mark Hyman is, I really think of Mark as one of my mentors because he wrote a book I actually bought for all of my doctors called The Ultramind Solution, because I'm like, the brain is an organ, like your heart is an organ. And if your body's not right, your brain's not right. And the Ultramind Solution really became the textbook for us on, okay, this is how you get your brain right, right? I guess he should have called it the Ultra Brain Solution, because your brain creates your mind. People don't get it. They sort of think the brain and mind are separate. And no, just think of Alzheimer's disease, right? Somebody's brain deteriorates, their mind deteriorates. You got to think of it, I think of it sort of like hardware and software. Get your brain right. So much easier to program your mind.
The book Ultramind Solution, and my business partner, Dr. Hyman, you mentioned him, and you guys are contemporaries. You've worked on a lot of really great stuff together, great projects together. One of the core messages inside of there, which you also talk about and have your own way of saying it, is that what you do to your brain, you do to your body. And what you do to your body, you do to your brain. There's that interlink that's there. When did that get super clear for you? And can you remember some of the first science you came across that was showing you that this is not just anecdotes that have been talked about in ancient traditions for a long time? There's actually an interconnected superhighway that's going on in the background that's linking these parts of the body together.
So, over this brain journey over the last 30 years, as I would read that omega-3 fatty acids enhance brain function, or if your gut's not right, your brain's not right. But the one study that just brought it home to me is from the University of Pittsburgh. And it basically said as your weight goes up, the actual physical size and function of your brain goes down, which should just scare the fat off anyone. I actually have published 3 studies. Last year, I published a study on 35,000 scans, one of the largest imaging studies ever done. And there was basically a linear correlation. As your weight went up, the function in every area of your brain went down. And just horrifying. And then when you understand it, you realize fat cells produce inflammatory adipokines or cytokines. Fat cells take healthy testosterone and turn it into unhealthy cancer-promoting forms of estrogen. Fat cells store toxins. They prematurely age the brain and lower blood flow to the brain. It's like, oh my goodness, I need to work to get my body right. And now with 72% of Americans overweight, 42% of us obese, it's just the biggest brain drain in the history of our country, which is why I wrote my book, Change Your Brain, Change Your Body, because we just have to get so much more serious about the food we put in our body, about our level of exercise. And I come from a family of fat people. My dad used to get mad at me when I would say that, but I have a brother and sister that are like 150 pounds overweight. And I'm like, not okay with this because I know it impacts them cognitively.
You know, over your career, which has spanned decades, you've been a pioneer for helping people see the hidden forces that are out there in the world, things that we've gotten used to that are so much part of our society that are having a dramatic impact on our brain. And these hidden forces are, some of them are mental health related, and a lot of them are physically related, or physical health and how that impacts the brain. I'd love to start off from the physical side. So on the physical side, what are some of the things that you look out there in the landscape and you see where we're at as a society, especially Western societies, where you have these increased rates of depression and other mental health conditions, but you also have these other functions that are happening to the body, which are affecting brain health, like increased obesity. So let's just talk about some of the hidden forces that are out there that are wreaking havoc on our brains and bodies.
Well, I call the standard American diet weapons of mass destruction. So ISIS just has nothing on our food industry. The real weapons of mass destruction are highly processed, pesticide sprayed, high glycemic, low fiber food like substances stored in plastic containers. I remember driving down the freeway here in Southern California, and I was going from where I live in Newport Beach to LAX. And as I was driving down the freeway in Long Beach, I looked to the right side of the freeway and I saw this sandwich billboard for the sandwich called Tower of Torta from AM/PM, one of the gas stations out here. And I'm just like, unbelievably unhealthy and high caloric. And then on the other side of the freeway, I saw a billboard for lose weight with lap band. And it just reminded me how crazy we are in this society. Let's spend a lot of marketing dollars getting you sick, and then we'll do surgery to get you well. And I'm like, this is insane. And so marketing to make money, or let's take a beautiful woman like Catherine Webb and put her in a bikini and have her eat a Carl's Jr. double cheeseburger. And I'm like, because what's the message, right? Is if you eat that sandwich, she'll want you. Well, I can guarantee you if you eat that sandwich, she will not want you. But it's that unconscious assault that is being done on our society, making us want things that hurt us. And it's just doesn't stop from, Happy Meals are really sad meals, right? When you understand what Happy Meals do to your body. There are all these lies that just sort of circle around us, from social media to the news. If you really want a healthy mind and body, turn off the news, because the news is meant to scare you. It's this great documentary on Netflix, The Social Dilemma, which will just horrify you because you realize people are making money off of your early death. And we just have to be more careful as they took PE and music out of schools. That's not only bad for us physically, it's also bad for us emotionally and developmentally.
It seems that also part of what you're saying, and please feel free to correct me if I'm wrong, is that there's a downward cycle that starts to happen because the foods that we're attracted to that are highly marketed, highly processed foods that are designed to hijack our taste buds and keep us wanting more, those are also the foods that damage our brain. And when our brain is damaged, it's harder and harder to make choices that are in our best interest and society's best interest. Is that a little bit of what I'm hearing?
Absolutely true. So I did a large brain imaging study looking at normal. And at the time, I didn't exclude being overweight or obese as an exclusionary criteria. But to be normal for our study is no psychiatric illness, no first degree relative with a psychiatric illness, no drug abuse, head trauma, and you're not taking any medication. Well, when I realized this connection between weight and the brain, I then went and looked at our normal group and then my NFL group, which we can talk about. Same position, healthy weight, overweight. They had low activity in their frontal lobes. The people who are overweight, whether it's in our normal group or in our NFL group. And why would that be a problem? If you have low activity in the front part of your brain, your prefrontal cortex is called the executive part of the brain because it's sort of like the boss at work. When your executive brain is sleepy, it's sort of like the boss is on vacation and you don't make good decisions. And ultimately, the quality of every aspect of your life comes down to the decisions you make. And so if because of the messages that we get bombarded with over and over from the billboards, from the signs of the fast food restaurants, it damages your frontal lobes, we're in big trouble as a society because we will end up to be a leaderless society because individuals won't have good leadership in their own heads.
When you look around and you even shared with your own journey, you were headed in this downward cycle yourself. You weren't taking care of necessarily or paying attention to your brain. Maybe at the time you weren't overweight, as I understand it, even though you come from a family, you mentioned about your family. What were some of the first steps that you took once you saw your brain that started to create, even in a small way, an upward cycle? So instead of a downward cycle, you're now headed upwards, and you're starting to take control of your brain health.
So I actually was overweight because I just hadn't thought about it. Now, I would have never let myself get out of control like my siblings. I'm way too vain for that. That would have made me really unhappy. But when I sort of made that connection, as your rate goes up, the size of your brain goes down, I lost like 25 pounds. I'm like, no, this is not good. I think the first thing was this concept I call brain envy. So seeing my mom's perfect brain, mine that wasn't healthy, I wanted her brain. And then I started playing with the term brain envy, right? Being a psychiatrist, learned about Freud and penis envy. And quite frankly, I haven't seen penis envy once in 40 years. What I really want to do is let's get rid of that concept. That wasn't helpful. But let's really get people to want a better brain. So we have a foundation called the Change Your Brain, Change Your Life Foundation. And we have cool T-shirts that on the front says Freud was wrong. On the back, it's brain envy. Everybody loves that T-shirt. So the very first step to getting well, to being optimal, is brain envy. You have to want it. And the longer you do this, the more simple things become for you, at least for me. Brain health is three things: brain envy, avoid bad, do good. Right? I can put my whole work in 6 words: brain envy, got to care about it; avoid bad, got to know the list; do good, you just have to know the list. And every day, I ask myself this question: is this good for my brain or bad for it? And if it's bad for it, I don't do it. Why? Because I love myself. Doing the right thing is never you should do it, right? I'm not a fan of shaming people. I'm a fan of motivating people based on, so what do you want? I want energy. I want good decisions. I want longevity. I want love. Is this good for my brain or bad for it? And then you have to know the list. And there are lies in our society, like marijuana is innocuous. That's a lie. I published a study on 1,000 marijuana users. Every area of their brain is lower. Now, people who are listening to this are not going to like me, and I'm okay with that because I have the data. Alcohol is not a health food. Any alcohol is bad for you. The American Cancer Society came out last year and said any alcohol increases your risk of 7 different kinds of cancer. So the idea that alcohol is a health food is just complete crap as far as I'm concerned. Plus, as a psychiatrist, the biggest problems I have are people drinking and making bad decisions, whether it's criminal or relational or financial or with food. Alcohol does not enhance decision making. And that's been hard, right? I don't really like making people unhappy. But ultimately, I do the right things out of love.
And I think it's important to speak up when you realize that also you have an opportunity to shift the narrative, or at least what's considered part of the discussion, which you do with all the people that are paying attention to you. And it takes courage. It takes courage to be able to speak up, because you present, especially in this day and age, but this has probably been there for humanity for a while. We tend to look at things as either black and white. It's either this way or it's this way. And there's not really an in-between. Perfect example that relates to what you're bringing earlier is obesity. You have one group that might be, an extreme sort of body positivity movement that says, anyway, any size, all good. And yes, everybody should love themselves. And yes, you should fully feel happy with wherever you are. And there are people that are overweight that actually want to be healthy. They want to lose some weight. They want to look better. They want to feel better, and they have every right to. Then you have another side, which, as you mentioned, you're not into shame, but there is a lot of shame from people that are saying, why can't you do it? It's a moral failing. Just lose a little weight. And anybody who's been overweight knows that neither one of those things are the complete picture, right? So I'd love for you to add your nuance and your perspective, just as one example on the topic of obesity, which we've been talking about, and being overweight. How do you look at it in a much more nuanced way than the discussion is often presented?
Well, I mean, we're in a war. I wrote a book called The Brain Warrior's Way because I truly believe you're in a war for the health of your brain and your body. Everywhere you go, someone is trying to put bad food down your throat that will kill you early. From those big billboards I discussed, you and I travel, at least before the pandemic. Every time you go to the airport, 90% of the food is terrible for you. It's a war for you. So you have to have sort of a warrior's mindset. You have to be armed, prepared, and aware of, those factors that make you more likely to be unhealthy. And then to realize it's never about shame, it's about love. That if you love your life and you want to live a long time, that there are decisions that you have to make early on and then continue. A lot of people don't understand that mental health is the same discipline as physical health, that these are practices you have to do day in and day out. One of the big things I've learned when it comes to obesity is one treatment will never fix everyone. In fact, it's one of the major principles that underlie my work. As I talked about different types of anxiety and depression, there are different types of obesity. There's impulsive obesity. People have low frontal lobes. They have problems consistently making good decisions because of the impulsivity. There's compulsive overeating. It's like you just can't stop thinking about the brownies, the donuts, the ice cream, the things that are driving the issue with weight. There's impulsive compulsive overeaters. Often they have alcohol in their family, alcoholism in their family. There's the sad overeaters using it to medicate an underlying depression, and the anxious overeaters. So knowing your type is really helpful to getting to the right solutions for you. And all diets are different based on brain type. So, for example, our impulsive group, think of them sort of like our ADD people, they do really well on ketogenic diets. They do well on higher protein, lower simple carbohydrate diets. Put a persistent or a compulsive overeater on that diet, they become mean because they focus more on the things that upset them. So adjusting the diet based on their brain, I think that's one of the big innovations that we've made based on our clinical experience and our imaging experience. Everybody's a little bit different. A high protein diet will increase dopamine in your brain, help you focus. A high carbohydrate diet will increase serotonin and help you feel happy. That's why Krispy Kreme works, because it makes a lot of people happy, but it's one of the fixes that fail, right? Happy in the short run, really unhappy in the long run.
You know, some of those examples that you gave about different forces that are driving people when it comes to, let's say, overeating, which obviously is one part of the spectrum that's connected to being overweight or obesity. There's other parts that we've talked about in other interviews that you've also mentioned, like environmental toxins and other things, and obesogens and plastics in our water and other things that all play havoc on the body. But going back to those some of those mental motivations, you in your most recent book, you have a whole thing where you're talking about the hidden forces that impact us and when it comes to our mental health. And you call some of these forces dragons of the past. And I'd love for you to just give an overview of where that languaging came from and what it means for the people that are listening here. How would they know if they have dragons of the past that are influencing their behavior and maybe even keeping certain addictions or patterns, negative patterns, alive, even though if they don't want them?
Well, my new book, Your Brain is Always Listening, I wrote about sort of the big forces that your brain is paying attention to. And in the book, there are bad habit dragons, and there's the scheming dragons. These are the societal dragons, like the contact sport dragons, right? The NFL owns a day of the week. I mean, how horrifying is that? A sport that damages people's lives owns a day of the week. And as I was writing the book, I'm like, the brain's also listening to the past. And for some people, their past is always in front of them. And I came up with the term dragons from the past, from my friend, Dr. Sharon May. She would use that analogy in dealing with couples and couples counseling. It's like, what are the big issues from the past, the dragons that breathe fire on your emotional brain? And then she and I collaborated on, it's not just couples. They're tormenting individuals. And we came up with 13 dragons from the past. So, and the pandemic is just exploding the population of dragons. So the first one is the abandoned, invisible, or insignificant dragon. And that's my primary dragon. One of seven. I'm third. I'm the second son in a Lebanese family, which meant you're completely irrelevant. In a Lebanese family that owns a grocery business, I mean, my family has 10 stores. My dad ended up being the chairman of the board of a $4 billion company. I mean, he was really smart. But I always knew my brother was going to succeed him. And when I was young, that really made me feel insignificant. I mean, the huge blessing is I could do anything I want. It gave me total freedom. But when you're young, you don't really see that. And I've really built a life on significance that when I help someone, that makes me happy. It sort of soothes the fire breathing dragon. There's the inferior flawed dragon. This is the one that's driving the epidemic of teenage suicide, where you're comparing yourself to other people in a negative way. Rampant. The anxious dragon, worse now than ever before in American history. The wounded dragon. So many people were traumatized during the pandemic. The should and shaming dragon. I grew up with that one as well, being Roman Catholic. I was an altar boy. My mom was serious about this. I remember when I was 6, I told a lie and my mom started to cry. And she said, I never thought I would have a son who was going to hell. And my mom was a good mom, but that was a bad moment for her. But so many people are just driven by what they should do rather than what they want to do. And I tell my patients, I said, whenever you go, you should do something. I want you to ask yourself 2 questions. Do you want to do it? Or does it fit your goals to do it? And if you don't want to and it doesn't fit, you have no business saying should. They find that really helpful. And then there are other ones, but to highlight for the pandemic, the grief and loss dragon, very common. People lost their businesses, they lost relationships, they lost loved ones. I lost my dad early in the pandemic to COVID. And each of the dragons, their strategies. So, for example, the death dragon, which has just been exploded during the pandemic with the death numbers. And, 6-year-olds are worried about dying because it's just part of the conversation now in a pandemic. And one of my favorite strategies for the death dragon is write down 10 good things about dying. And people go, what? And I'm like, I never have to deal with LA traffic again. It's horrible. Or I just went to the dentist to get my teeth cleaned. And for like an hour, she's like poking with a sharp object in my gums. And I'm like, I don't have to have that anymore. I never have to have a computer go down and lose an hour's worth of work. So that strategy, it's the denial of death. Elizabeth Kubler-Ross said this. I love this quote. It is the denial of death that is partially responsible for people living empty, purposeless lives. Because when you think you're going to live forever, you don't take care of the important relationships you need to today. And when I was in college, I took a death and dying class and had to write my own funeral. And so I always sort of lived with the end in mind. Not that, this is all meaningless, but this is really important. And I want to spend today as if it is a gift and that it's special.
So beautifully said. We also, well-intentioned, but sort of backfiring. We've so hidden death in our modern society compared to a lot of other countries where my origin is from in India, somebody passing away and, a body being brought through the streets and, for eventual cremation, as a lot of people there believe, and everybody seeing it and not hiding from it. And now death is so hidden from our lives that it feels so distant to a lot of young people, that many of them have never seen a dead body from a family member or somebody there to understand the preciousness of life that exists. So another version of our sanitization that came from good intentions, but ended up separating this idea that that death is not very much a part of what it means to be alive.
That's so important because actually the fear of death haunts so many people, and I think they just never really wrestled with it. They're just afraid of the darkness. And I love this quote. I was on Sadie Robertson's podcast a couple of weeks ago, and she goes, "What's the best piece of advice anyone has ever given you?" And in Byron Katie's book, Loving What Is, I read, "Argue with reality. Welcome to hell." And I'm like, okay, so that's going to happen. So how am I going to deal with it? And, one of the things I do is I prepare my estate appropriately so my children and wife won't have to suffer. Too many people, because they're in denial, they don't really take care of the stuff that they should do to protect their loved ones. And it's just sort of a practical example of how to deal with the death dragon. It's like, oh, so, that's going to happen. Let me take responsibility for what I did during my life and not leave a mess for other people.
Hey, YouTube, if you enjoyed what you just saw, keep watching for more great content on how to improve your brain and your life.
There's sugar in everything that's ultra processed, because that's what the food industry did on purpose, because that's how they hooked you in the first place. It's really easy to fall off the wagon because